Is there still a donut hole in Medicare prescription drugs that could cost you thousands of dollars? Medicare Part D plans generally do not always cover all prescriptions that can be given from your doctors to be treated for ongoing conditions. When it comes to Medicare, prescription drugs also use what are called cost-sharing tiers, which group your prescriptions into 3 or even 4 different levels. To make things more complicated, Medicare plans change their tier levels of prescription drugs every year. Each year, an annual flurry of changes takes place in the basic insurance policy for drugs, which makes for a donut hole, a coverage gap in your monthly prescription bill, requiring that you make up 25% of the total cost until you reach the out-of-pocket level. Fortunately, once you reach the out-of-pocket limit, you generally pay a smaller portion of the total cost for your prescriptions, no more than 5% of the prescription costs, until the end of the year. To simplify this explanation, let's take the example for the Medicare model published in the year 2023. In this example, you are diagnosed with a condition that requires 1 generic drug and 4 brand name drugs. First, you have to meet the standard deductible before the plan will pay for your drugs. You find out from the drugs you're taking that your estimated annual drug costs are nearly $18,000 a year if you were to pay the full price. Ouch! You notice on your first pharmacy visit, your set of prescriptions seems very expensive, costing you approximately $753.75. This is because you are responsible to pay for the full price of the drugs out of pocket until $505 is paid to meet the annual deductible plan requirement, before only having to pay 25% of the prescription drug cost, which makes up the remainder, $248.75. You return to the pharmacy next month and notice that your bill is much cheaper, as you only end up paying 25% of this total, amounting to $375. This is because the plan and the manufacturer are responsible to cover the difference. By April, you reach the donut hole after reaching the initial coverage limit of $4,660. But notice your trip to the pharmacy is still $375. This is because of a coverage gap discount that's covered by the manufacturer. For the year 2023, the discount on generic and brand drugs is 75% when purchased in the coverage gap. Because of your expensive drug costs, you end up reaching a catastrophic coverage level, and notice your monthly prescription prices actually drop to only $75 a month for the rest of the year, beginning in October. This is because once you reach catastrophic coverage, you keep it until the end of the year. Therefore, after reaching your annual deductible, your cost sharing does not end for the remainder of the year, unlike in the past. Figuring all of this out alone can feel impossible. Fortunately, there's a better way. At Newport Benefits Insurance Solutions, our agents are licensed and ready to assist you in finding the most suitable plan to fit your needs. Get in touch with one of our agents from Newport Benefits Insurance Solutions today, either by calling 949-258-9338 or by emailing us at hello@newportbenefits.com. You can also visit us at www.newportbenefits.com.